Welcome to your roadmap to Medicare. Now, this roadmap was customized based on questions that you've answered, either by talking with our client services team or by going online and taking our online quiz. So what we're asking is, if you have friends or family that need guidance into Medicare, please have them either go online and take our quiz or schedule a consultation with one of our team members, because everybody's situation is just a little bit unique. And we want to make sure that people get proper advice specific for them. Because as we've discovered, there could be serious consequences for not enrolling in Medicare when appropriate or not choosing the appropriate coverage for yourself. So what we're going to talk about today is your roadmap. So your roadmap to Medicare is based on the following information. I want to talk about the primary insured. So remember, the primary insured, it may be you if you're the employee that holds the health insurance, but the primary insured may also be your spouse if you're the dependent on your spouse's group health insurance plan. So the primary insured must be actively at work at the employer providing the group health insurance, and you must be covered under that group health insurance plan. The employer that's providing the health insurance has more than 20 employees, meaning it's a large group, and that you have a high deductible health insurance plan and you're making contributions to a health savings account. If that's the case, you can defer Medicare Part A and Medicare Part B when you turn 65. You do not need to enroll. So let's first talk about how to defer, and then we'll talk about the reasons why you may or may not want to defer your Medicare. So defer, it's a simple process. As long as you're not collecting Social Security income prior to your 65th birthday, you should not be automatically enrolled in Medicare. So by doing nothing when you turn 65, you have deferred your Medicare by default. Because if you wanted Medicare, you would have had to go online and enroll in it. So not collecting Social Security income, do nothing, and automatically deferred both Part A and Part B. But if you are collecting Social Security income, when you get your red, white, and blue card in the mail, because then you're going to automatically be enrolled in Medicare. And when you get your red, white, and blue card in the mail, you can fill out the back and send it in and return specifically your Medicare Part B. That's what you're paying for, the Medicare Part B. So you can return that and not pay for it until you're ready to retire or come off of your group health plan at a later date and you can enroll. So some people get nervous about that and they say, well, I heard there's penalties or lockout periods if I don't enroll when I'm 65. So let me explain to you how that works. When you enroll in Medicare later, over age 65, it's pretty easy. There's a one-page form, and we can provide you with that form, or you can go right to Social Security and request that form as well. It's called an employment verification form, and you're going to take that to the employer that's providing the health insurance for you, and they're going to complete it saying that the primary insured was actively at work and that you were covered under those group health insurance benefits from the time you were 65 till the time you're ready to enroll in Medicare. And as long as you haven't had an 8-month lapse in your coverage, you are eligible to get right in the door to Medicare with that form. You take that form and it's kind of like a golden ticket. It's your ticket for admission to Medicare. You take it down, you say, I'm ready to enroll, and they say, okay, what date should we start it? And you can start it the first of the month of your request. So let's talk about Medicare Part A and Part B, and should we defer both of them? So Medicare Part A. Medicare Part A has no cost for many people. As long as either you or your spouse has paid Medicare taxes for a minimum of 10 years or 40 quarters throughout your lifetime, you qualify for Medicare Part A at no cost. So it doesn't cost you anything. Why not? Why not just enroll? Well, a couple reasons. Number one, Medicare is going to sit secondary to your group health insurance plan. If a company has more than 20 employees, your group health insurance plan will remain your primary insurance as long as you remain on the plan. So even if you do take your Medicare Part A, it's going to sit secondary to your health insurance. So when you have a claim, the claims are going to first go to your group health plan, and then if there's anything out of pocket for you, that would switch over to Medicare, and they would pay a portion of that depending on the benefits. So it's likely that you would receive little to no benefit by having Medicare Part A, but again, it's no cost, so why not? Well, here's why not. because you're making contributions to your health savings account. Medicare law says you can make contributions to a health savings account as long as you do not have first dollar health insurance benefits. And they do consider Medicare Part A to be first dollar health insurance benefits. So if you enroll in Medicare Part A, it's free, it sits secondary to your health insurance, so you're not going to get an awful lot out of it, and it's going to disqualify you from making future contributions to your health savings account. Now, the good news is you can continue to use the funds out of those health savings accounts until they're depleted. In fact, you can even use those funds to pay for some Medicare premiums later, as well as out-of-pocket expenses and prescription copays. But if you enroll in Medicare Part A, you can no longer make deposits into that health savings account. And then for Medicare Part B has a cost. Now, the cost is dependent on your income, so it may be different for many people, and we do have a training video talking about Medicare Part B and what the costs are. But Medicare Part B does in fact have a cost. So many people do not enroll in Medicare Part B until they're ready to come off of the group health insurance, because again, it's going to sit secondary to your health insurance, so it's not going to provide you an awful lot of benefit, and it's going to cost you money. So many people do defer that until they're ready to go into Medicare full-fledged later. So again, Medicare A and B we can defer. In fact, you're going to definitely want to defer your Medicare Part A, because if you don't, you can no longer make contributions to your health savings account. So I just want to touch on one more thing with that. Let's say you're collecting Social Security income. If you're collecting Social Security income, when you turn 65, you are automatically enrolled in Medicare Part A. And you cannot cancel it, because if you do, you will have to pay back any payments made to you in the way of Social Security income. So if you're collecting Social Security income, once you turn 65, you will have Medicare Part A, which means you will no longer be able to make contributions to that health savings account. So I hope that made sense. Now let's talk about, you don't have to enroll in Medicare. Would there be any reason why you would want to enroll in Medicare and replace your group health insurance plan? So when you turn 65, you have a life event, and that's an opportunity to get out of your group health insurance plan and go into Medicare if you want to. So how do people determine what's better, Medicare or group health insurance? And for the most part, it drops down to cost. So what I want you to do is I want you to think about what premiums you're paying for your group health insurance plan now. What's coming out payroll deducted out of your paycheck to pay those premiums? And just bear in mind, if you're covering premiums for both you and a spouse, remember that the amount paying for both of you may not be equal. So you're going to want to go to your employer and say, how much would this be for the employee only versus how much is it for the spouse? Because a lot of the times we find that employers make higher premium contributions to the employee than they do for the dependent spouse. So dependent spouses cost more to remain on the group health insurance plan. So I want you to think about that premium, and then think about the out-of-pocket costs, those deductible costs that you're going to have on the plan. How high is your deductible? And are you frequently satisfying that deductible? Is your health such that you typically satisfy most, half, maybe all of that deductible every year? So do you think your out-of-pocket costs, premiums, plus deductibles, copays, co-insurances, everything except for the prescription piece, do you think that that averages to more than about $300 a month? Or averages to more than about $3,600 a year? If not, then I can tell you that Medicare will not be more cost effective. Your group health plan is going to be lower cost than Medicare, so it may be a good idea to stay there until you're ready to come off later. But if so, or maybe you're not satisfying your full deductible now, but you're concerned about the risk in the future. If I get sick, maybe I have a $5,000 deductible, and that's gonna be a hardship for me. So if that's the case, and you think that there's a chance that you may pay more than $3,600 a year in premiums and out-of-pocket medical expenses, then Medicare may make more sense for you. It may be more cost-effective. And I'm not suggesting that you just jump right off of your group health plan and go into Medicare if that's the case. What I'm suggesting is let's do a cost analysis. You can give us a call. You can use our online scheduling tool to schedule a consultation, and we'll lay out the costs and coverages of Medicare and then your group health insurance plan, and you can make an educated decision what is most appropriate for you now. And the good news is, let's say you decide not to go into Medicare now. You feel, oh, I'm pretty healthy, I'm not using much of my deductible, it's not too expensive, I'm going to stay where I'm at on my group. That's okay. You'll still have plenty of opportunity to get off later. In fact, every year on your group's renewal or your policy anniversary date, you will have an open enrollment to either opt out or stay into your group health insurance plan. So if your rates go up or your deductible goes up or your health declines and you feel like you might be satisfying more of that deductible in the upcoming year, then we can take you off at that time and put you into Medicare. And then of course at the very least, we can take you off at retirement and put you into Medicare. And again, it's only that one-page form that your employer fills out that is your ticket in the door to Medicare when you're ready. So I hope that made sense. As I said, you do not have to enroll in Medicare when you turn 65, but the choice is yours, and we're happy to do a cost analysis for you. So I appreciate your time today, and please feel free to reach out to us if you have any questions or concerns. All of our consultations are completely no cost.